It's Fred Huerta with Nightingale College, and today I'm going to be demonstrating administration of a subcutaneous injection. First thing we're going to do is gather our supplies. We're going to want a 25 to 27 gauge 5/8 inch needle. We're going to want to get some gloves, gauze, alcohol prep pad, 1 milliliter syringe, and then we should be good to go. Next, we're going to verify the healthcare provider order and compare it to the MAR. The order reads 1,000 units of heparin sodium, subcutaneous injection, 1 dose. Next, we're going to verify the 6 rights of medication administration, which are the right patient, drug, dose, route, time, and documentation. Then we perform the calculations needed for our dose. So it's going to do desired over half times quantity. So we desire 1,000 units, and we have 10,000 units for every 10 milliliters. So that should 1,000 divided by 10,000 times 10. You should get 1 milliliter for our dose. Next, we're going to go ahead and gather our supplies and enter the room. Knock on the door, perform hand hygiene, pull the curtain for privacy. Okay. Hello, Mr. Victor. My name is Fred. Could you please, I'm going to be your nurse today. Could you please tell me your name and date of birth? Okay, I'm going to go ahead and verify your wristband. Look at your wristband, verify that name correlates with the name on the order. Mr. Victor, before we continue, is it okay to talk about your healthcare information in front of your guest? Yes? Okay. Victor, do you have any allergies that you could let me know of, such as allergies that are seasonal, allergies to medication, or to food? No? Okay, great. Victor, your doctor has ordered heparin, 1,000 units to be injected subcutaneously. Um, this medication is an anticoagulant. It's used to treat blood clots. Um, some some common side effects are pain upon administration. You might feel some itching, and you might feel a headache is common. So adverse effects would be chest pain. If you have chest pain, let us know. If you start coughing up blood, or if you have blood in your stool, let us know right away so we can help you out. Okay. Um, do you have any questions for me at the moment? No? Okay. So we're going to go ahead and get this process started. So I'm going to go ahead and wash my hands, don some gloves. Okay, so yeah, don some gloves, and then you're going to get our syringe, 25 to 27 gauge 5/8 inch needle. We're going to open up the packet just like that. Pull it out of the container, hold it up like a pencil, keep the cap on, pull down to, we're going to pull down because we're going to administer 1 milliliter. So we're going to have 1 milliliter of air in there. Okay, I'll just place that aside. Next, we're going to go ahead and get an alcohol swab and clean the top of our vial. Okay, dispose of that in the trash. Let that air dry. And then we're going to get our needle. Yeah, we're going to get our needle. Uncap it. Place that right there so we can do the scoop method later. And then inject the air into the vial. Okay, so that's in there. Now we got negative pressure. We're going to flip the vial upside down. Okay. And then we're going to go ahead and pull down to 1 milliliters. And then if there's bubbles in the syringe, I'm going to want to flick the syringe. And if there's too much air inside the syringe, then we're going to just have to reinsert all the medication back into the vial and re-withdraw. Okay. So flip it back upside down. Release that. Okay, with one hand, we're going to do the scooping method. Go ahead and get that cap Oh, snaps. That's a fail. So, scoop. Perfect. All right. So you don't poke yourself. And pull that down. Now we have 1 milliliter of heparin, which we're going to be administering. Okay, place that aside. Now we're going to go ahead and toward the site at which we're going to be injecting. So we're going to choose the abdomen for the subcutaneous injection. We're going to be go ahead and assess the patient. We're going to be looking for edema, bruising, or any signs of inflammation, any signs of infection. We're going to palpate. We're going to palpate for any tenderness or pain. We're going to palpate for masses. If there's a mass, don't inject that location. Choose another location. And then we're going to go ahead and measure what the site. So we're going to want to pinch the skin fold with your forefinger and your thumb. And then measure it with the needle. The needle should be half of the skin fold. Okay. So that looks about right. Now that we've chosen the site on the abdomen, we're going to go ahead and get an alcohol prep pad and clean the area. It's circular motions from inner to outer, so inner, outer, and an approximate area of 2 inches. The more the merrier, but 2 inches is all that is required. Okay. Next, we're going to let that air dry, and don't touch this after. Don't touch the site as it's air drying with your hands anymore. Okay. So next, we're going to go ahead and grab our heparin and grab it in a dart fashion. So first finger and thumb, and then I'm going to pinch the skin of the abdomen, creating that fold. Okay. So we got that fold that we require, and we're going to go at a 45 to 90 degree angle. Okay. So we're going to go insert it quickly. Let go. Now switch hands. We're going to stabilize it over here. And then with my other hand, I'm going to go ahead and push down on the plunger. Okay. Now the medication is administered. Now we're going to slowly, now we're going to take it out. Pull the gauze on top. Dispose of our syringe in our sharp needles bin. Okay. And then we're going to check this side out. If it's bleeding, we're going to put a band-aid on. Okay, it's not bleeding, it's dry. Everything looks great. Put that in the trash. We're going to grab all of our supplies, throw it in the trash, remove the medication, put it to the side, not in the trash. Okay, I'm going to remove my gloves. Not yet, don't remove your gloves yet. Ask the patient, are you feeling okay, Mr. Victor? Do you feel anything? You feeling okay? Okay, great. All right, here's your call light. Position the bed in a comfortable manner, and that's it. Okay, so we're gonna go ahead and make sure all fall precautions are put in place. And then we're gonna remove our gloves, perform hand hygiene, and document what we performed.